Hello friends, welcome to a new lecture today. It is on surgical instruments. This instrument it is called as Lahey's cholecystectomy instrument. So cholecystectomy forceps. So how are you going to identify this? This looks like a curved artery forceps. It mostly looks like a curved artery forceps. Looks like it's not curved artery forceps, but it looks like a curved artery forceps, but it is thin and slender. Okay, so as a result it has a lock here. Okay, and it also has a curve, and if you see at the tip of the curve there are some horizontal serrations. So these horizontal serrations will help to hold it properly. So these are the main ways how you can identify it. That is, it is used in the lock, it has a lock, and it has a curve, and it has horizontal serrations. But how are we going to differentiate it from artery forceps? It is by just it is thin and slender, but the rest all it will be similar. So it is used for cholecystectomy. In cholecystectomy operation we use this forceps. So this is about cholecystectomy forceps, Lahey's cholecystectomy forceps. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.